welcome to another episode of Affogato with Ananya. This is the 7th episode and we'll talk only about obstetrics and gynecology in AGMC. Please introduce yourself.
Hi everyone, I'm Dr. Deeksha. I am currently pursuing post-graduation in the Department of Obstetrics and Gynaecology at Agartala Government Medical College and Hospital, Tripura.
So tell me, from where you did your UG?
I did my undergraduation from BLD University's Sri B.M. Patil Medical College and Hospital, which is in Bijapur, Karnataka.
So tell me, how has been your journey so far?
Journey so far has been great, full of highs and lows, but a great learning experience.
So how's the number of professors? How many professors are there in your department?
We have 2 professors in our department, out of which one is the HOD, followed by 3 associate professors, 7 assistant professors, 5 senior residents and medical officers, followed by 12 number of post graduations. But there's a catch here. The number of seats per year has increased in our college from this year, and we'll be admitting 8 new PG students from this year onwards.
Wow. So in your batch, how the seats are distributed among the all India quota and the state quota?
Alright. We have 4 seats per year as of now, out of which 2 are allotted to the state quota and 2 are for all India quota.
How a typical day of an Obs-Gynae resident doctor looks like?
So no 2 days are alike, and your day is really unpredictable. First things first. A typical day starts at around 8:30. Your OPD starts at 9. Before that, you have to give some sort of rounds on your own. See all the patients which were admitted earlier, and you should know about the patients, and you have to see those patients before your OPD. The OPD starts at 9, ends by 4, but the admission day continues till 9 in the next morning, and you have to be in the hospital throughout that duration, followed by OT the next day.
So that's a very hectic schedule.
Pretty hectic, very, very hectic, but so worth it.
Okay. So tell me, how's your first year of residency was like? Because now she's my co-PG and we are in final year of the post-graduation. So describe it.
The thing is that in our department, in our college, all the 3 years have to work till the very end. Yes, the first year is relatively tougher because you're so new to everything, but it gets easier with passage of time. Also, I would really like to thank my seniors who were always so supportive, always less than a call away for all our doubts and queries.
So Deeksha, tell me how you cope up with the challenges and the difficulties you face in the residency, especially considering the nature of Obs and Gynae, we all know, but how you cope up with it.
So like if I'm facing some troubles, first thing I talk is to my co-PGs and my immediate seniors. Second, definitely my comfort zone is my parents and my UG and school friends. I talk to them.
So tell me about academics in your department.
So like we have journal club 2 or 3 times a month, and on Fridays we have our seminars, and on Saturdays we have our case presentations, which alternates between an obstetrics case and a gynae case. We are allotted moderator for each of the academic activities to help you with the topic.
So what about conferences, workshops you have attended so far?
So far, I got the opportunity to attend state conference last year, and we'll be soon attending the national conference to be held in Mumbai. So you're given opportunity to attend various conferences throughout your tenure as a postgraduate.
Like why you took up Obs and Gynae?
Obstetrics and gynecology was not my first choice for post-graduation. My first choice was medicine, and I always thought that I could not pursue surgery. But after joining Obs Gynae, I started liking the branch and the surgical aspect of it, and it actually made me realize that if you do not get what you love, love what you get.
So Deeksha, tell me what you do in your free time. What are your hobbies?
So as an obstetrics and gynecology resident, you hardly get any free time, but if I do get so, I like to read books, I like to talk to my friends, I like to scroll Instagram, and I like to go out with my friends whenever I can. Something as simple as making a cup of coffee is enough to uplift your mood.
Coffee gang, coffee gang.
It's coffee gang.
So what is the current book you're reading right now?
So I'm currently reading The Stationery Shop in Tehran, which is a love story. I've just begun it, so it's too early to say anything about it.
So do comment down below, so all the subscribers and viewers, which book you are reading currently right now.
Yes.
So my next question is, Deeksha, tell me what are the options one can pursue after completing their degree of MS Obs and Gynae?
So obstetrics and gynecology can be considered as an end branch to a very large extent. Having said that, you can pursue MCH in the fields of gynae onco, fetal medicine, reproductive medicine, and minimal accessive surgery. You can also pursue your DM in fetal medicine and reproductive medicine. Plus, there are plethora of fellowships which are available in our country, which include gynae onco, cosmetic oncology, perinatology. You can also pursue a fellowship in obstetrics and gynecology, USG, high risk obstetrics, fetal medicine, reproductive medicine, among a lot many other options. These are mainly available in central institutes of our country like AIMS Delhi, PGI Chandigarh, Tata Memorial Hospital. It is also available in Manipal. So you can always choose from a variety of options which are available.
So, are there any super specialities available in our AGMC?
There is no super specialty course which is available in our institution as of now. Having said that, you get exposed to a variety of super specialities in our institute, which include laparoscopy, and there is a budding IVF center in our hospital as well. You do get exposed to a lot of super specialty arenas in our institute.
So one of our subscribers asked about the IVF and laparoscopy and a lot of things. I hope the question is answered well. What kind of a person should take up obs and gynae? Because a lot of people are looking up to you to clear their doubts whether to take obs gynae or not.
Okay, so one thing which I would really suggest if you're taking up obs and gynae is that you should be able to manage your hectic lifestyle. You should have that thing in you to work for really long hours, and I think work-life balance is something which you have to create. It does not come inherently with this branch. You have to create that for yourself.
So Deeksha, you are from Delhi. So अभी तक तुम्हारा त्रिपुरा में in terms of food and culture, how has been your experience till now?
Tripura is a majorly non-veg consuming state and I'm a vegetarian.
Okay.
So yes, I did have some problem in adjusting to the food culture here. But again, I could manage. You have tiffin services here and you get a variety of vegetarian options as well. So you can manage here in terms of food. As in terms of culture and language, yes, initially it was a hurdle. But soon I could catch up with Bengali because it is pretty much similar to Hindi. So I could grasp a lot of Bengali, and now like I'm in a position where I can actually take history and interact with patients. So yes, I'm in a better position now, definitely.
That's good to know. Approximately how many months it took to you to learn basic Bengali?
Basic Bengali I was able to speak within like 5 to 6 months, and now I can manage alone in terms of speaking the language.
The kind of cases you come across on daily basis, you would like to share?
So the best part about this college is that every other day you see a lot of interesting cases. All the cases which you read in textbook, you can actually see them. I've seen a lot of placenta previa cases, ruptured uterus, obstructed labors, CPD cases, medically complicated pregnancies like GDM, gestational hypertension, hypothyroidism, anemia, severe anemia, you name it and you have it. We have seen post-op complications also in terms of pulmonary edema, hematomas. We have seen all of that.
So
Thank you for having me here in Ananya Didi, and I hope that I could answer a lot of your queries related to obs gynae in general as well as obs gynae in AGMC. If you have any further questions, I'll be glad to answer them in the comments below. You can always ask me anything related to the department. At the end, I would just like to say that optimism is always a choice that you make. Obstetrics and gynecology is definitely a hectic branch, but you learn to traverse through it as you progress in your journey of residency and in the profession in general.
So thank you, and make sure to
like, share and subscribe. Yay.
So this is picture for the thumbnail.